This evening we are talking about how acupuncture and counselling can support fertility treatment, and we're being joined by Harley Street Fertility Clinic and counsellor Molly Granique. So welcome, thank you for coming today or this evening. I am Eloise. I'm sure many of you know me joining. I am the founder and director of Fertility Help Hub, and as you may know, I have been through my own personal IVF journey with sperm donor conception, and I founded Fertility Help Hub to give people access to the expert resources that I wish that we had had during that very difficult time. So I'm delighted to be talking about these holistic topics tonight because having been there firsthand, I have experienced how important they are. And then welcoming Dr. Gita Venkat, who is the Medical Director at Harley Street Fertility Clinic, and Molly Granique, who is the Counsellor at Harley Street Fertility Clinic. So welcome to you both. If you could please introduce yourselves.
Molly, please.
Good evening. I am Molly Granique and I am a specialist fertility counsellor and also a midwife, and I have worked in many different clinics across the country, supporting people through their fertility journey and in the hope of achieving the success that everybody going through this journey so deserves.
Great, thank you.
I am Dr. Gita Venkat. I'm the founder and director of Harley Street Fertility Clinic. We started this clinic now, it's in 10 years since we started, and we always had a holistic approach because I think there is a lot of emotional factors involved in fertility. It is very different from other diseases. I wouldn't call it a disease, actually. It's a unique condition where there is a lot of emotional overlay in this condition. Say, for example, we are doing something like somebody has got appendicitis, there is no emotion attached to that. You go to the hospital, surgeon takes out the appendix and you come home. Whereas this is a journey and we need to give a lot of support during this, and we believe this is also part of the treatment. So we say we care for the patient rather than doing the treatment. We look after the patient. We cover all the aspects, and every step of the way the patient is sort of helped, and by nurses, doctors, and receptionists, everybody. And we have specialists like Molly, the counselor, we have acupuncturists, and we have hypnotherapists, all in the same building under one roof. So we think that it will be a useful service. Please make use of this, because not all the clinic have these facilities to give you all the support you need with the right specialist. That is why we say we give you bring the experts to you to give you all the support in your emotional journey.
Thank you.
Thank you.
So just a little bit of housekeeping before we start. It will last about an hour, and there'll be a mini presentation from both Dr. Venkat and from Molly, and then we'll finish with the brilliant questions that everyone sent in when you registered, and it will be recorded so that people can watch it back. If you have any questions, please click on the raise hand option. There's also a chat box where you can communicate with other participants. And of course, if you want to stay anonymous, that's completely fine. There's no need to say your name, and you can keep your camera off. So Dr. Venkat, you've just obviously introduced yourself and Molly, and do you want to say a few words about Caris?
Right. So Caris is our associate who is an acupuncturist, qualified and experienced. That's the main thing. And she's gone through a difficult time in her life, so she can relate to your feelings and empathize with you very well. And when I tell the patients to go and see Caris, people always have, doubts about it. All modern people think, what is acupuncture? Is it going to be really useful? But I tell them, look, we are offering you a complimentary session. You are not paying for it. Go and see her. And then once they come back, their view is totally changed. They always say, she is like a magical person, and I feel different now. That's why she has been doing great work in our clinic. And she makes the patient's journey less stressful. That's our aim here as a group and as a team. Molly on one hand and Carrie's on the other hand. And we have on top of it, Susan Hepburn, who is our hypnotherapist. Sorry, Carrie's and Susan could not be here today for some personal reasons, but they are all stars helping our patients through this difficult journey. Thank you, Elise. Right, so as I mentioned earlier, we started our Harley Street Fertility Clinic in 2010. And initially it was a small clinic, and then we slowly and gradually expanded. Then we developed our own larger site, and there we have got our laboratory, theater, and all the facilities. It's one of our ethos saying that we should not send the patient to different places and different buildings for different tests and different procedures. And we should have everything under one roof, and all the specialist treatment should be available in one roof. And that's why we have specialists like urologists, gynecologists coming to our clinic, and they will see the patients in our clinic so that you get the expert here. And we also have holistic approach because we think the fertility journey should be supported well by the specialists in this field, such as counselors, acupuncturists, and hypnotherapists. As we all know, there is a lot of emotions associated with fertility treatment. Even before entering the fertility clinic is a big step for so many couples, because they always tell me that, look, we have been thinking about it for a few years, and we kept postponing it. That is because I think they didn't have the courage to bring themselves to the door of the fertility clinic. It must have taken them a lot of effort and courage at that stage. So from there, the stress starts, and all these emotional feelings like, why is it happening to us? We are a failure in our lives. Well, others can do it. I can't do it. Why me? All these things, questions come in their mind, and they always don't know the answer. They suffer more. And then when there is some disappointment in the clinic, they start crying. They burst into tears for nothing, which people sometimes cannot understand. Therefore, we always think it is important to give them support from the initial consultation, because when we change the consultation, the appointment for some reason, some women really start crying, and we think, what is the problem here? That is, receptionists always come and tell me, look, she was very upset when we changed because we didn't know the reason for this. Then I always tell them, look, they always faced this disappointment in their life. Every month they are hoping that they won't have a period, but they end up seeing the period and they are so disappointed. And when you change the appointment, that is another disappointment for them. They think, oh my God, my life is full of disappointments, and they start feeling depressed about it. And they don't want to talk to anyone in their family about it because they are ashamed of it. That is the reason we said, we will give them all the support, make their journey bearable, I would say, not better or very pleasant, but bearable so that they don't suffer, they don't go into depression. And we also offer this counseling, acupuncture, even before they start the treatment, during the treatment, even after the treatment, because you do not know what is going to happen in the treatment. It can be a successful outcome or an unsuccessful one. Therefore, we offer support before to prepare them, during the treatment to reduce the stress, and after the treatment, in case it's not a good outcome, we are there to help them to pick up the pieces and restart everything in their lives. Next slide, please. Right, so now to see how the acupuncture can help. There are so many papers and so many people say that, oh, acupuncture increases the success rate with IVF. Then on the other side, people also ask you questions. Is it really so? There is always controversy about this. But the main thing I would say that it works on certain principle. It reduces your stress during the treatment or even before and after. So reducing the stress means it brings down the prolactin hormone, which is one of the stress hormone. Prolactin is supposed to be a hormone which interferes with ovulation. If someone's prolactin is very high, their cycles become irregular and they don't ovulate regularly. So high prolactin interferes with this. That is why the stress can interfere with ovulation and conception and everything. So if we reduce the stress, and it increases the natural conception. Therefore, there are different ways and we can do it. And when somebody does the acupuncture, people reduce their stress, and also they have a sense of well-being after the acupuncture session. They feel good about themselves somehow. And in our clinic, Caris also listens to the patient very well. She is a good listener. She listens to them about their stories and try to give them some tips how to sort of reduce the stress in their life, how to view the things in a different way. So she is helpful for the patients, and that's why the patients always tell me that, oh, she works wonders. I feel very different after seeing her, and I would like to see her more. And do we recommend all the patients? Generally, if anybody is anxious or finding it difficult to cope with the treatment, or particularly not doing very well with the treatment, then we recommend them to see Molly, the counselor, and Caris for acupuncture as well. But are there any clinical cases where the acupuncture is recommended? If you think of it, yes. Nowadays, we see a lot of women with low ovarian reserve. And what can we do? The acupuncture, we can help them by giving acupuncture, and it improves the blood supply to the ovaries mainly. Thereby, it can increase 1 or 2 eggs in number and also improve the quality of the eggs. Therefore, in reduced ovarian reserve, we advise them to speak to the acupuncturist and have some acupuncture sessions. And I'm happy to say that we offer 1 complimentary session along with IVF treatment for all our clients. And that keeps Caris extremely busy because there are so many patients going through, and they make use of this session. And during the treatment, again, people get stressed because the whole treatment is like a roller coaster. People who have gone through the treatment will know very well. One day you come to the scan, they say, oh, everything is going well. Your follicles have just started growing, and it's good news. And then you go home happy. Next scan, things are not doing well. The person who is doing the scan will say, either the doctor or the nurse or the ultrasonographer, this time your follicles are slowed down a bit. They are not growing as I would like them to grow. I don't know, it's a bit slow. Then everybody gets so upset, look, because they're spending a lot of money injecting themselves with hormones. And it is like the whole life depends on these things. They want the treatment to be successful. So when they don't get such good news, they immediately become upset. Sometimes they start crying and they don't know what to do with these things. It becomes like a hopeless situation for them. Under these circumstances, we also recommend them to go and see the acupuncturist for a session, which will help them. And there are other particular conditions like thin endometrial lining. That is, sometimes the uterine lining does not get thick, and that is one of the problems. The previous slide, I lost slip.
Right.
Yeah, sorry about that. Okay, so when the lining of the womb is thin, we advise them to go and see the acupuncturist. Again, by doing certain sessions with them, what they do is they put needles on certain points, which are the pressure points for certain areas in the brain, which control these uterus and ovaries. By controlling them, they increase the blood supply to the uterus, thereby make the lining slightly better. With the medication also, they work together, make things better. And on the day of egg collection and on the day of embryo transfer, particularly before the embryo transfer, we recommend every patient to have a session of acupuncture with them, with the procedure, because it relaxes them nicely. Embryo transfer is a procedure where everybody should feel good about it, not in a tense situation, and relax the whole body, and they should enjoy the procedure. Afterwards, also, we want them to go home in a relaxed way. and we give them some injections. Sometimes if they are very tense and they have anxiety, it causes cramps in the uterus, which is not good. Therefore, we do acupuncture, the injection and some tablets, reduce the cramps in the uterus. So before these procedures, it is a good idea to do the acupuncture. And when woman gets pregnant, also we can do, say somebody has got a repeated miscarriage or recurrent miscarriage, acupuncture can help to reduce the stress and anxiety, because I have seen some patients with recurrent miscarriage. Even today I scanned a lady. She said, please, can you scan me every week? I am so anxious because I will lose this baby. Scan is not going to prevent or do anything. However, they want reassurance and reduce their anxiety. And under these circumstances, acupuncture can also help them. And for the pregnancy to go well, it is helpful. Now, in this situation, when the couple comes to me, I get asked one question frequently. That is the male partner. He says, doctor, what about me? Are you going to offer me any acupuncture? Then I always tell them, look, yes, we should not forget the man. When we say during the investigation, we should not forget the man. Similarly, for acupuncture also, we say we should not forget the man. I always ask them to go as a couple. When the woman has acupuncture, the man sits with her and explains to the man, the male partner, what she is doing, what is happening, so he can also understand and take part. That is not the only thing. Supposing there is a male factor involved in the fertility issue, like somebody having low sperm count or reduced motility or some issue like that, or even no sperm sometimes, they can go and see Caris, because when there is low sperm count or low motility, Caris does again some acupuncture in certain areas whereby she can increase the blood supply to the testicles and improve the sperm quality and the sperm. I'm not saying she can do magic and change the sperm count from 1 million to 100 million. It's not going to happen. But whatever it is with the capacity you have got in your body, she will help things to get better. And it will also relax the man, because he knows that something is being done. With all the other things, lifestyle changes and medications with the supplements, antioxidants, things can be better. So if there is any male factor, men can also have. In fact, I know a couple in our clinic who had a severe male factor, and then after some treatment, IUI treatment, the lady miscarried. But then they kept seeing Caris for a few months. In the end, she conceived naturally, and Caris, they saw Caris after that also. And her pregnancy, I'm happy to say that her pregnancy is going well. Therefore, it can help in certain cases where people are very anxious. So we should say both women and men should have acupuncture in selected cases, and when they believe in it, then it will help. Next slide, Elise, please. Right, so like I mentioned before, the main factor involved in acupuncture is stress reduction, and thereby we control the elevation of certain hormones which are associated with stress, which can interfere with the conceive, like ovulation first of all, and conception. Therefore, we can prevent that. And hormonal imbalance can also lead to miscarriage sometime. Therefore, it can help with miscarriage. And I don't need to tell you about the stress of IVF treatment. Therefore, it's useful before, during, and after IVF treatment to reduce stress and to help with the control of emotions. Or it will give you some coping mechanisms, make things better in your life, and give you a sense of well-being. And we say it's a good idea to do it on the day of procedures like egg collection. More than egg collection, embryo transfer is the important procedure where the embryo is going back inside. Even though it's a very simple procedure, you put the embryo in, it takes only 2 minutes. But it's an important procedure, sensitive, emotional, and it has to be done so gently. Always say that embryo transfer should be smooth and silky, like the patient should not feel any pain, should be relaxed, both parties, and it should be such an enjoyable procedure. And with acupuncture, it goes well smoothly, and it has that added factor of reduction of stress, and calming somebody. And that is the most important thing at the time of embryo transfer. I don't think just having acupuncture will make someone pregnant. No, I will not say that. But it makes things easier and helps in the process. That's all I would say. Next slide, please, Elise. I have to now hand over to Molly, who is an expert in this field. She will tell you more about it.
Good evening. Why have counselling during fertility treatment, during the fertility journey? These are questions that are often asked. People say, I don't need to have counselling. I feel as though I have considered the implications of the treatment that I'm having. And that's absolutely, your prerogative. Nobody can mandate about counselling, but there are certain aspects of fertility care that we need to implement and advise that counselling is an important part of the process. Why have counselling during IVF? IVF is a very emotional and physical journey as well, and it takes its toll on many couples, many women going through it. And the IVF process itself is really, counselling through the IVF process itself is really just to offer some support and some guidance through the clinical, the moral, the legal aspects of the journey. And of course, when you add another dimension to the IVF process with donor conception, then it's even more important that you have the opportunity to sit down and explore the implications of what that means, what it means to create your family through donor conception. Whether you are embarking on conception with donor eggs or conception with donor sperm, or indeed sometimes both, you need to consider the social, the moral, the legal, clinical, physical aspects of the treatment process that you're about to embark on. And there are the laws in the UK changed in 2005 that now permit children to have access to find out who their biological donors are when they reach adulthood. And so to that end, we have to prepare people going through donor conception for the expectations that at some stage in their child's life, they may want to access who the donor's details, and find out really through curiosity or for other reasons, find out from where they came and to whom they are related by having half brothers and half sisters in the world. So there's nobody can force you to engage in fertility counselling, but it's strongly recommended, so that everybody is aware of the implications of donor conception and what that means. Most people research this process themselves initially, but a lot of people, they are so keen to have the treatment process that they tend not to really give any credence or some credence to the child and what it means for the child to be born as a result of donor conception. And I think one of the big things is that in the UK alone, which is a pretty small community in the grand sort of scheme of the larger world, in the UK alone, something like 3,000 children every year result from donor conception. And in order to try and minimize the possibility of your child having a relationship with somebody that they later find out they're genetically linked, we feel it's important that everybody knows what they're doing in this regard. We can talk a bit more about that with questions, but I just go on down onto egg freezing for social reasons, because this is something that is becoming more and more sought after, especially as young women embark on careers and engage in relationships later on in life. Many women come to a clinic and say, I want to have my eggs frozen. And of course, the best time to retrieve and freeze eggs is when somebody is much younger than the age that they usually appear at the clinic. And you know, first of all, we need to warn any young woman that's coming to the clinic for social reasons that the possibility is that we do some tests and we find out that they actually don't have any eggs to freeze, which is a very shocking thing for any young woman to hear. And so it's just, you know, fertility counselling does not make that better. As Dr. Venkat says, you know, it doesn't make anybody pregnant, but it just prepares people for some of the possibilities that they might have to face when they go through the treatment process. Egg and sperm donors, they, again, a bit like anybody, you know, involved in donor conception, are expected to go through a process of fertility implications counselling so that they are made aware of the expectations that we have as licensed clinics, that we have of any egg donor or sperm donor, and that is that they keep us updated with, or the HFEA updated with any sort of change of address or change of circumstances in their families, and so that we can always have access to them should a child or children want to know from where their donor gametes came. Moving down again to social and the moral implications, again, it's not for us as a clinic to make any judgments on people's request for donor conception. It's for us to make sure that we give people the information that we feel is important for them to base their own decisions on where they go with the information, what they tell their child. Again, the laws support children to find biological donors when they reach a certain age, but there's no law that can force a parent to tell a child that they've been donor conceived. That is something that we would strongly recommend. Likewise, there's no law that can force a donor to be receptive to a child seeking access to them. So these are the things that we have to just, at some level, prepare people for, and make sure that they're aware that there are absolutely no guarantees with donor conception. There are lots of expectations, and we would like to think that those expectations would be met. The people who come into the clinic to donate sperm or eggs are usually coming in to help other people, and you know, it's an amazing gift that they're giving other people. And so to that end, the integrity of these people is usually pretty sound, and we would expect them to honour the expectations that we have of them. Moving down to surrogacy, very, very complex situation, especially in the UK at this time. The laws are rather archaic, and we are trying, you know, to bring them up to speed with the needs of surrogacy. But at the moment, the laws in the UK state that a woman who gives birth to a child is deemed the legal parent, irrespective of where that embryo and how that embryo was created. It is transferred into a surrogate's womb, and therefore the surrogate who gives birth to the child is deemed the legal mother until such time as parental orders and adoption processes are firmly put in place. And so emotional support through fertility counselling will help people come to terms with these these laws, and encourage them to seek their own sort of reassurance, perhaps by means of a specialist lawyer who is up to speed with fertility issues, and make sure that they have a pre-birth agreements set up, pre-birth contracts set up, which of course again are not legally binding in this country, but they give, if something were to go awry, and if the surrogacy, the intended parents, commission and couples went to court to secure the welfare of a child, a judge would take into consideration the pre-birth agreement, even though it's not legally binding. So it gives parents, commission and couples, and surrogate parents a better understanding and a better way of presenting their case to a court should something like that happen. We would certainly hope that it doesn't happen, but sadly it has, not very often, but it has. So we have to prepare people for most eventualities along their fertility journey. Thank you.
Thank you, Molly.
Right. So, like I mentioned before, we feel that fertility journey is not complete without all these support systems available in our clinic. That's why we have this holistic approach to the fertility treatment. We say we have to help the couples with counseling in case of any issues, and just a support as well without any issues to reduce their stress and prepare them for the outcomes of the treatment as well. Acupuncture, as I mentioned before, and hypnotherapy. These are the triads of all this support system we have in our clinic, and we believe that everything should be available under one roof. That's why we have it in our clinic. And now with the, of course, COVID-19, things have become different, and we offer this counseling on telephone as well as on video, Zoom and other Skype. Well, with the lockdown, during the lockdown, we didn't offer acupuncture. Then since then, we are offering acupuncture now. And Caris has got permission from her council also that she can continue to offer acupuncture. So it's available during the treatment. And hypnotherapist Susan Hepburn is also in our building next to my room. And she is offering hypnotherapy. Hypnotherapy, of course, is not for everyone, and it is for selected cases. You may be wondering who will need hypnotherapy, where there is a lot of psychological issues involved. I can give you one example. There is a condition called vaginismus. I don't know that many of you are familiar or not with this condition. This is a condition where the women have phobia for anything going into their vagina. So they can't allow the partner to get nearer to her to have sex. Some of them can't even have sex. And under these circumstances, of course, there's no question of trying, and they come for treatment. And in fertility treatment, as you're aware, we have to monitor the woman with internal scans, that is vaginal scans. And these women cannot have vaginal scans at all. And they need to do abdominal scans and blood measurement of estrogen and other hormones. So we have to use other methods. And any procedure we do for them has to be done under anesthesia. So we have to make special arrangements for them. And we do it. For these women, the vaginismus is due to mainly a psychological fear of things going into the vagina. Sometimes it could have been due to some abuse in the childhood as well. And they have a lot of counseling, but it takes years and still they can't get over the fear. And under these circumstances, sometimes hypnotherapy can be useful because they sort of make the brain or, see the condition for, see it in a different way. That's why it's called, they put you into hypnosis and make you see the whole point in a different way so that the woman is able to get out of that fear and allow things to happen. That is hypnotherapy. Again, don't expect in any result in one session. These things take few sessions to occur, and we recommend it under these special circumstances like this. It will be very useful. And if some people find it difficult to have putting the speculum inside the vagina during some procedures like embryo transfer, then hypnotherapy can be useful instead of anesthetic medications and other things, because if woman is hypnotized, then she doesn't have the pain and then we can do the procedures. So hypnotherapy is useful. And some women don't like to take medications, and therefore under these circumstances, it will be helpful. And when we offer this, and I also mentioned about support for the men. Don't forget the men. They are also human beings. They don't show the emotions like the way women do, but they still have feelings. Today, I had to give a man the result of semen analysis, and he didn't have any sperm. When I told him, he nearly burst into tears. He said he suspected that something was going to be wrong because I had the initial consultation with them 3 days ago. He said, I want to do my test also, doctor. He volunteered. Usually men don't volunteer to have the test. Then I asked him, is there any specific reason? He said, yes, my brother had some problem, and he and his wife are going through IVF, he said. So he suspected something could be wrong. But however, he told me that he never expected that he would not have any sperm. And he said that, look, he really broke down. And I was thinking of Molly. I was thinking, look, I will arrange some counseling for you. My friend Molly will be there one day to talk to you soon. And we will get through this difficult time. Because that's why I feel like men also need support. So we must offer them counseling at the right time. And like females, when we face when they have difficult time. And this is not only the specialist available in this field. In the day-to-day, every day, when patients come for injection, some people have fear of needles, and they don't like us taking blood, and they need some counseling at that time. So the counseling starts from our receptionists, nurses, embryologists, doctors, everyone, you know. So it is like the whole clinic is involved in the counseling process or supportive system, but we have the specialist give you the right advice and right way to tackle it. And we have the full support of the specialist in this field. Next slide, please, Elise.
We've got a video here to play, haven't we? So shall I?
Yes. So, you know, this is to show how the support is useful during the journey. And after that, you know, they are so grateful for the clinic's help in their journey with the stress associated with it.
So
yes.
People that you've seen treated.
Dr. Venkat, I just don't know what to say about her. She's such a lovely lady. When I saw her first time, she made me so comfortable. It's like I'm just meeting my mother. Every time, whenever I have a problem during my treatment or even the after treatment, I have called her many times, and she's always ready to help. I remember during my son's treatment, so that was the frozen embryo transfer. And after the transfer, I wasn't bleeding, but I saw some blood spot, and I got really scared. At that time, Dr. Venkat was on holiday, and I didn't realize, well, she did tell me that she was on holiday. I was so scared. I just called her, and I can't believe she picked up my phone. She talked to me. I felt so relieved at that time. And yeah, as soon as she came, she saw me, she did my checkup and everything, and I was so relaxed. She's just like a mother, to be honest.
My name is Daisy. I'm a patient at Harley Street. I've been there for a few years. I got a positive result, so I'm currently pregnant, and Joanna has been amazing all the way through. She really helps lighten the mood when you see her at reception desk. Whenever I pick up the phone, and you always know it's Joanna, and she's like, hi, my darling, how are you? Whenever I was sad or annoyed or irritated, she'd pull me out of the reception and just speak to me in the hallway, and give me the biggest hug, and she was ever so excited. She was one of the first people I told, because I took a pregnancy test way before I was meant to. And I went in to go and get my blood work, but I had the digital pregnancy test, and she was one of the first people that I showed, and she was so ecstatic. She was really excited, and she just hugged me, and she just couldn't wait. And every single time I phoned up, she'd be like, send me photos, I hope you're doing really well, we can't wait to meet her. It lightens up the place. Every single one of them is amazing. Obviously, Dr. Venkat, I owe her my baby. Do you know what I mean? She gave me the baby. Rachel is fantastic. Margarita and Adrian, they're wonderful. And then just the reception staff, all of them, you know, they've all got smiles on their faces when you walk in the door. And it just really helps, you know, when you're going there often and having grueling procedures, and, you know, maybe one day you don't get the right result that you wanted or the best news, just to know that they're there and, you know, to give you a hug if you need it, or just like a pat on the back when you're leaving or something like that. It just really makes you kind of take a deep breath in and go, oh, I've chose the right place. Like, it's the best place that I could choose anyway.
It's been a great experience, actually, having kind of the treatments and then the treatments with Caris to work together. It's turned out as a very holistic approach, I think, because you stay quite in touch with what's going on in your mind and your relationship and your life, and at the same time you know that you're moving forward. So it's been so positive. It's brilliant.
Perfection was to be with us, that experience. Really impressed.
Well, you can imagine how impressed and how grateful we actually have been that our daughter was named in honor of the clinic.
What I'm talking about, it's making me emotional. Finally got what we wanted, and it wouldn't have been without her. She cares so much about what she does. The whole clinic does. They just care so much about their patients. I've been to other clinics and it's so clinical and you're just a number, but with Dr. Venkat, you're just so much more. She is just the most incredible woman. She's so dedicated.
Our family. Our family.
So if we move on to the questions now, can people still see my screen? Can you see my screen?
Yeah.
Yep, okay, great. I'm just going to put it into full screen mode. So I think, Dr. Venkat, you will have covered some of these in the discussion that we just had about acupuncture. But around stress and the impact of that on fertility, oh, sorry, this one is actually for Molly. So in terms of counselling for IVF and for fertility treatment, how do people know what type of counselling would be best suited to their needs?
Well, I don't think people do know what type of counselling is most suited to their needs until they experience it, and it depends very much on what those needs are. And I suppose I have the luxury of being quite eclectic in my counselling. The way I counsel, my undergraduate was as a Freudian psychoanalyst, and my postgraduate was in something called Gestalt, which is a much more holistic and much more person-centered therapy. I also work with some CBT exercises, which are sometimes very useful, you know, in the fertility journey, because the essence of CBT, cognitive behavioral therapy, is that the way you think, your cognitive function influences the way you feel, and the way you feel in turn will determine how you're going to behave. So if you want to feel differently, think differently, you have to behave differently. You have to do something different. So looking at your needs within the counselling session, we will be able to establish perhaps what you are doing that perpetuates the stress and the lack of hope that you're, you know, experiencing, and see whether we can't make some changes in your behavior that will then help you to feel a bit different and think a bit different about the treatment process that you're embarking on.
Thank you. And then we have quite a few questions around acupuncture. Someone has asked, and this is quite specific, can stress levels be alleviated by acupuncture, for example, becoming pregnant after loss or following stillbirth?
Yes, I mentioned in my speech that acupuncture can reduce generally any stress associated with fertility treatment or pregnancy as well. And particularly if something has gone wrong in the past, that's very important. People having recurrent miscarriage, for example, if they miscarried, say, around 7 weeks or 8 weeks, when they go through the next pregnancy, when that period comes, they are so anxious. And that's why they want to have regular scans to make sure, that is for reassurance. They want to satisfy themselves, my baby is all right. Because we get phone calls, oh, Dr. Venkat, I stopped feeling sick for 2 days. I think my pregnancy has stopped. Am I still pregnant? Can you check something and tell us? So they are all worried and anxious every day. And under these circumstances, of course, counseling will help, as well as acupuncture, because acupuncture also reduces the stress and anxiety associated with the previous history, like miscarriages at certain time, or stillbirth, or losing the baby at a later stage in pregnancy. All these things will help. It's not going to change your physiology, but it is going to reduce the stress and anxiety associated with the previous bad obstetric history. That's what it is. It will definitely help. And Elise, the next question is also about acupuncture.
Acupuncture and health. And I know you touched on the biological impact, and you mentioned AMH levels, etc. So any more you wanted to say around that topic and how it might be able to support this?
Yes, so particularly I mentioned that when people have difficulty in making their lining thick, because some people have this problem, especially after cesarean section, they form what are called niche. That is, there is some fluid collection along with the scar of the uterus. That's why women find it difficult to get pregnant after a cesarean section. The secondary infertility is higher after a cesarean section compared to natural deliveries, normal deliveries. That is because of the complications of the cesarean section scar. Sometimes it could have got infected and forms a niche and collection of fluid. This fluid is an infected fluid, and it contains all this bad bacteria, and that leads to fluid collection in the uterus, and the lining remains thin. Under these circumstances, we do certain things medically, but at the same time, acupuncture can also help with the blood supply, which will help to thicken the lining. And again, increasing the blood supply to the ovaries, that can improve the egg quality and egg number. So if you want to know which areas should be treated, it depends on where the problem lies, and the acupuncturist will take a detailed history, and she will be able to make a diagnosis and tell you how she should treat you. And she will make out a program for how many sessions are needed and how frequently one should have acupuncture. She will be able to give you guidance on that.
Great. And in terms of trying to conceive naturally or with treatment, it can be beneficial for both.
Yes, so I also mentioned that one of the couples having difficulty, and she had a miscarriage after natural conception, and both husband and wife were seeing acupuncturist carries, and on a regular basis they used to come every week. And if say they are not able to come together, they used to come separately and have a session of acupuncture, and they got pregnant again. We did the scan, pregnancy was going well, and they continued their acupuncture weekly, and in the end, the pregnancy was okay this time. That is the reason she had a lot of anxiety associated with the pregnancy because of the previous miscarriage. And with Carrie's help, she was able to carry the pregnancy till the end. She's still pregnant. She hasn't delivered the baby. We will hear the news very soon.
And you just touched on it. What about the areas of the body to be treated for fertility acupuncture?
Yes, so Caris is the right person to answer this, but what I would like to say is, like I said, there are areas in the brain which control the different organs in the body, that is the ovaries and the testes in men and the uterus. And she has some points in the body where these are all controlled, and with the placing the needles, they are stimulated, therefore they can increase the blood supply and other things associated with that. So that depends on where the issue is with the infertility, and she will give you the correct recommendation.
Thank you. And lots of questions, lots of the same question came in around the success rate of acupuncture. Is there any kind of data to back it up, or any kind of findings that support the benefits?
Yes, success rate associated with this acupuncture and natural conception is difficult to give a data because, you know, nobody has tested in the general population with the randomized control trials of one group having acupuncture, one group not having acupuncture. That is really difficult. I think some of the acupuncturists have so many patients treated with acupuncture, and how many got pregnant, they might be able to say. But I would say, look, if there are real issues, then you must see the doctor also and do medical treatment. Just having acupuncture is not going to solve a major problem in infertility. Supposing the woman does not have any eggs, and that means then she needs donor eggs. But to make things better, you can use acupuncture. But if she doesn't have eggs, and having only acupuncture is not going to make the woman pregnant if she has run out of eggs. So medical treatment is needed along with that. But natural conception, if everything is okay, they can try acupuncture to reduce the stress, and hopefully conception should happen. But it's difficult to give any success rate with that.
Mm-hmm. And what about timings for those different stages that we've just touched on?
Yes, again, acupuncture is not going to be over in one session, because this is a series of treatments, and depending on the severity of the problem and degree of anxiety and the stress with the issue and the person's personality also. Basically, if someone is an anxious personality, it's going to take a long time to get rid of these things slowly. And therefore, Caris will make an assessment initially. That's why her initial consultation is for 1.5 hours. She takes a detailed history and do an assessment, and then she will tell you, look, these are the issues. So you will need something like 8 to 10 sessions, and you can do it once in 2 weeks. Or if it's really want it quickly, then once a week she will arrange the appointments. We can do it. Depending on the issue, then we have to do basically 4 to 6 sessions or 8 to 10 sessions, depending on the long-term or major problem, minor problem, and degree of anxiety with that.
Right.
And that's how I would view that.
I think you touched on this earlier, and from my own experience of having acupuncture to support IVF, even for my peace of mind, having it pre and post embryo transfer helped me with my nerves and anxieties, and I actually fell asleep after embryo transfer with acupuncture. So again, helping with the anxieties that came with it.
Yes, that's right. That is why we have made it a routine practice in our clinic to offer acupuncture before the embryo transfer, and it is complimentary free. There is no charge for this, so that patients don't have the anxiety of paying for it and other things. It's all part of the treatment, and we do it. We find that all the patients are all happy, smiling, and more relaxed for the procedure. And it helps them as well as helps the clinician. On the whole, it's a nice experience, and then hopefully we think it would be successful.
I think could I just come in here, because we focused very much on the merits of acupuncture and how it helps to de-stress the body, but I think also I have to impress on our listeners that there are many other ways of managing stress and fertility, not just acupuncture. And acupuncture is really about changing the energy in the body and increasing the blood supply. And there are other ways and means that you can engage in some relaxation, visualization exercises that will also sustain, a reduction in stress hormones, which of course we know are very powerful, and we want to keep them to a minimum. But I think, engaging in some counseling to help manage stress is also a very useful technique.
And there are visualizations that you can take on for other aspects of your life as well, aren't they? I still use visualizations from IVF to control myself in other situations now as well.
Yeah, there are.
Yeah, that's right. And Molly is right. Molly has been with us for a long time, and I know Molly very well. We are very good friends and colleagues. She's right. And we actually offer 2 sessions of counseling free with the treatment. We think that counseling has an important role to reduce the stress. Not only acupuncture, but counseling also. We offer 2 sessions, and a lot of couples also take up on this offer and use it to their benefit. You are right, Molly, correct. Yes, we agree with you.
And then I think just to finish off with the questions that have come in before we open it up to further questions around everything holistic that we've just discussed. Common questions that came up were around any risks or side effects of having acupuncture whilst having medical fertility treatment, whether it could be harmful.
Yes, so if there are some medical conditions which are contraindicated for acupuncture, Molly will not, not Molly, Caris kept talking about Molly, so I repeat the name. Caris will not do it. That's why she needs to take a detailed history about all the medical conditions you have. And if somebody is prone for infection with the needle pricks and it's not allowed, like very low immunity, she won't do that. And it's sort of not harmful after implantation. Some people believe that, it can disturb the pregnancy. That is not true. The person who is doing the acupuncture should know that you have had IVF treatment, had the embryo put back. And therefore, they will be careful. They will not do certain things which they are not supposed to do when one is pregnant. So it's important you give them the full information. Of course, in our clinic, if you are doing it, Caris will know about it or Molly will know about it. Otherwise, it's important to be open and give them all the detail. Cost, of course, it depends on how many sessions you need. And that is, like I said, if it's 4 sessions, it will be, I don't know per session how much it costs. If you contact the reception, they will tell you. It's in our website also, you can look it up.
And you mentioned this earlier, but what's the situation? Is acupuncture okay now with the tier system during lockdown? Well, during COVID?
Yes, so when we closed the clinic during the first lockdown, the acupuncture was stopped. We could not do anything. And then we started the treatments in June. At that time, first month, Caris did not offer acupuncture. We were not very sure. And we contacted our regulators, and then Caris contacted her counsel, and we got permission from both the parties. Then when we started offering it from July, now we contacted them. They have given permission for the acupuncture sessions to be continued. And we are always very careful in what we are doing, check with the patient and make sure the patient is okay to have the procedures.
Mm-hmm. Thank you. We've also had a question around acupressure versus acupuncture. So unless you want to answer that, I know that Caris is happy to take questions following the webinar. So I'll contact the contact details for Harley Street, and if anyone wants to contact me to go through me, then they'll be there too, whatever you need. So I'm going to stop sharing for a second and open up the questions. So if you do have any questions, please write them in the chat box now. Someone has asked, do these acupuncture sessions within the package, are these acupuncture sessions within the package, or are they an extra charge? I think you mentioned that, but would you mind just repeating what you said around that?
Yes, of course, it's no problem, Alice. Yes, one session of acupuncture is included in the treatment cost, and particularly for the fresh IVF cycle, we say do it just near the day of egg collection or on the day of egg collection. And for the embryo transfer cycle, we say do it on the day of embryo transfer, or if you want extra sessions, of course, one has to pay for it.
Okay. And then another question, recommendation on when to start acupuncture before IVF.
Yes, that is actually a very good question, because people don't know when to start and they think that, okay, just before we go for egg collection, we'll do it. Ideally, they should start before they start their stimulation to prepare their body for the stimulation process. And during the stimulation, they should have 2 or 3 sessions. And on the day of the egg collection, we finish it. And nowadays, because we do divide the IVF into 2 stages, that is, first one is the stimulation phase, second one is the embryo implantation phase. So therefore, they can have some 2 to 3 sessions during the embryo implantation phase also. At least this improves the success rate nowadays. That's why we do that, because we are able to test the embryos in this process.
Mm-hmm. Great, thank you. And Molly, for you, last question, because we're just at time. When would you recommend people look into, hypnotherapy or counselling to support mental well-being during treatment?
Well, again, it's how long is a piece of string? People experience emotional trauma at different stages of their journey, and some people want to prepare themselves very early on for the difficult journey ahead. But most people seek counselling when they're at a stage of crisis. And of course, that crisis is very real for a lot of people. And the counselling session at that stage is mostly about just supporting people through the crisis. Other, counselling sessions are used to really prepare people for the way ahead, the possibility that pregnancy just might not occur. What happens then? Looking at their options, looking at the different aspects of fertility that are offered to them. So it's very, sort of tailored to people's needs.
Thank you.
If you have the luxury of, as a long-term therapist with working independently, therapy is a luxury, and if you can afford it, I would recommend that most people engage in therapy in this mixed up world. But we don't always have that luxury of finance or time.
I think what I found very beneficial about it was being able to talk to someone who was outside the situation, wasn't a relative and wasn't a friend. Somehow I found that easier in some respects than leaning on family and friends.
Well, I think because you can be quite candid, talking to family and friends, they have expectations of you and they're all waiting to hear this joyous news. And sometimes you just don't want to engage in that, or you can't engage in that. So you take on sometimes the responsibility for other people's feelings. And so talking to somebody independently is very useful in that regard.
Mm-hmm. Thank you. We've had one last question about acupuncture, and then I'm just going to put up, the details, contact details, in case anyone would like to make contact following what we've just discussed, and for further questions or consult or whatever it might be. One of the people on the webinar now has just said that she has tried 6 sessions of acupuncture and it hasn't gone well for her. I'm not sure why, but it for some reason she hasn't sort of benefited from it as yet. Would you suggest that someone who hasn't felt a benefit to it continues to try it? Or after 6 sessions, would you say that perhaps it's not the right avenue for them?
There could be 2 reasons, probably. As I said, each person is different. It may not be the right thing for that person. That is a possibility. or the person doing the acupuncture may not be the right person for her. So she should then change the practitioner and try and come and meet our acupuncturist. Have a chat first, see how you feel. And if you feel comfortable, try one session. You still think it's not the right thing for you, I think you should not go further along those lines. But you could try reflexology. We also offer reflexology. And people who are frightened of needles, needle phobia, under those circumstances, we have a reflexologist who can help you with. So if acupuncture is not the right thing for you, then you can try reflexologist, and that might help you. So you have to pick the right thing for yourself. That's a very good question, actually.
That's great advice. Thank you very much. Thank you, Molly and Dr. Venkat, so much for your time this evening. It's been hugely beneficial, and thank you everyone everyone who has joined as well.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.